Now, the number of dead from the outbreak in Italy has climbed by 837 to 12,428. Strict lockdown restrictions will be extended to after Easter, the 12th of April. Italy is the country with the highest number of dead, but there is some hope as a sharp decline in the number of infections has also been reported. Joining me now, Professor Eduardo De Robertis, an Associate Professor in Anaesthesia and Intensive Care Medicine at the University of Perugia. Professor, thank you for joining us on BBC World News. You're still dressed in scrubs. Have you come straight back from hospital, and what sort of day have you had there today?
Good evening, and thank you for this invitation. Yes, I'm coming back from the intensive care right now. There are hard days for us, but I mean we are dealing with that, and I think we are. I'm very feel that we are going to be successful, and to at the end we will deal with this emergency.
But you are in one of the worst affected areas, and if you've just come from a significant area, but in terms of treating people there, have you had all the ventilators and equipment that you needed, or have some people died who otherwise would have survived?
No, I think that we are lucky in this region because we are in the middle of Italy, and we have not been hit so hard as in the north. We had over the last weeks many people arriving in the hospitals, but fortunately we could deal with all of them, and there was very huge work made by the region, by the hospitals, by the university that have worked in as crazy, because we have seen what was happening in the north, and we have prepared ourselves somehow. And we have doubled our ICU beds in few days. We have reconverted hospitals, and we have stopped all the non-emergency surgery. And in this way, we were able. I mean, we are able now to face this it. And so I think that all the people that needed intensive care could be treated, and we are also starting to see some people coming out from intensive care. So it's
that is good news. But what about you on the front line? Unfortunately, we've seen a number of medics, professionals dying, succumbing to this virus. Do you have protective equipment? Have you unfortunately lost colleagues who have succumbed to this?
Fortunately, we have all the protections we need. Probably over the last days we have seen some shortage, but in few days we were able to receive all we need, and at the moment with the correct use of all the material, I think we can deal the situation. The problem is just the correct use of all the materials we have. For the operators as me that enter intensive care, respect to others that are not on front line in a way.
All right. Okay. Well, look, we all wish you the best of luck over the next few days and weeks ahead. Yeah. Professor Eduardo De Robertis, thank you very much indeed.
Thank you.